Hello. We're going to talk about a common symptom that some patients refer after a gastric sleeve or bariatric surgery, mainly when they have a big weight loss. Some patients refer they feel dizzy sometimes during the day. And there are two types of dizziness, we can say, that the patient refer. And it's important to learn to identify those so we can help patients correct that symptom. One of them is the patient that refers that feels dizzy when the patient stands up or get up from bed very fast. That is called orthostatic hypotension, and that is a physiological thing that happens when a patient loses weight. The adaptation mechanisms of blood pressure are changing when the patient loses weight. And when the patient changes position, the blood by gravity goes down and there is less blood in the brain. And you can feel dizzy at that moment. That happens in many patients during the first months after a bariatric surgery when the patient is losing a lot of weight. What can the patients do for that? Patients should increase the intake of liquid, any kind of liquid, water, juices without sugar, any kind of liquid that will increase the intravascular volume. We also recommend patients, if they don't have a contraindication, to increase a little bit the intake of salt in the food. If you increase a little bit of the salt intake, that will retain liquids inside of the vascular compartment and will help decrease the dizziness. The other kind of dizziness that patient refers sometimes is the patient that is doing his normal life and suddenly start presenting with tachycardia, is sweating, feels dizzy, weak, and has to sit down and wait for a while. That kind of dizziness that is not related to the change in position is usually hypoglycemia or a decrease in the blood sugar level. And that happens for several reasons. One of the reasons is that the patient with a gastric sleeve can have long periods without feeling hungry. So the loss of appetite will make those patients have to eat on a time basis. The second kind of symptom of dizziness that patients refer is that when patients are doing their normal life and all of a sudden the patient refers that feels cold skin, patient is sweating, feels dizzy, has to sit down and stop whatever they're doing, and sometimes they feel like a blackout. I mean, they can even lose consciousness. That kind of dizziness is usually caused by hypoglycemia or a decrease in the blood sugar level. That usually happens for two reasons. One of the reasons is that patients with gastric sleeve, they have a loss of appetite and they can they have long periods of time without eating and they don't feel hungry. So those patients should have a schedule of or timing for eating, even if they don't hungry. If the patients are not hungry and they avoid eating, they can have hypoglycemia after a few hours or 1 or 2 hours. So you should not have long periods of fasting after a bariatric surgery, even if you don't feel hungry. The other reason is the dumping syndrome. Dumping syndrome usually happens more often after gastric bypass, but it can also happen after gastric sleeve. I would say about 20 to 30% of patients with a gastric sleeve can refer a dumping syndrome at some point. The dumping symptoms presents when the patient eats sweets, something to eat, chocolate, ice cream, or even sweet fruits like grapes. That food that has a lot of sugar goes very fast into the small bowel and will be absorbed by the small bowel and will cause a sudden increase in the level of insulin in the blood. That high level of insulin will cause a sudden fall in the level of blood glycemia or blood sugar level, and that will go place to the symptoms of hypoglycemia. Dumping syndrome can also present not only with sugar but with some other food like fat, or patients that mix solid and liquid food at the same time. The main cause of hypoglycemia, dumping syndrome with hypoglycemia, is the consumption of sugar. So that's one reason patients should avoid sugar after bariatric surgery. Of course, they should avoid it because it can stop the weight loss. But if you don't avoid that and you take sugar and you're feeling dizzy very often, you have to pay attention to what you're eating, because you can be having dumping syndrome or hypoglycemia. Thank you very much.